Chapter 34, Heart Failure. While assessing a 68-year-old with ascites, the nurse also notes jugular venous distension, with the head of the patient's bed elevated at 45 degrees. The nurse notes this finding indicates increased right atrial pressure. The jugular veins emptying into the superior vena cava and then into the right atrium. So JVD with a patient sitting at a 45-degree angle reflects increased right atrial pressure. JVD is an indicator of excessive fluid volume, increased preload, not decreased fluid volume. JVD is not caused by incompetent jugular vein valves or atherosclerosis. Next, the nurse is caring for a patient who is receiving IV furosemide or Lasix and morphine for the treatment of acute decompensated heart failure with severe orthopnea. Which clinical finding is the best indicator that the treatment has been effective? Answer is reduced dyspnea with the head of bed at 30 degrees. Because the patient's major clinical manifestations of ADHF is orthopnea, caused by the presence of fluid in the alveoli, the best indicator that the medications are effective is a decrease in dyspnea with the head of the bed at 30 degrees. The other assessment data also may indicate that diuresis or improvement in cardiac output has occurred but are not as specific to evaluating this patient's response. Next, which topic will the nurse plan to include in discharge teaching for a patient with systolic heart failure and an ejection fraction of 33%? The answer is benefits and side effects of angiotensin converting enzyme inhibitors, or ACE. The core measures for the treatment of heart failure established by the Joint Commission indicate that the patients with an ejection fraction below 40 degrees receive ACE inhibitor to decrease the progression of heart failure. Aerobic exercise may not be appropriate for a patient with this level of heart failure. Salt substitutes are not usually recommended because of the risk of hyperkalemia, and the patient will need to see the primary care provider more frequently than annually. Next, IV sodium nitroprusside is ordered for a patient with acute pulmonary edema. During the first hours of administration, the nurse will need to titrate the nitroprusside rate if the patient develops what? The answer is a systolic blood pressure less than 90 millimeters of mercury. Sodium nitroprusside is a potent vasodilator, and the major adverse effect is severe hypotension. Coughing and bradycardia are not adverse effects of this medication. Nitroprusside does not cause increased ventricular ectopy. Next, a patient who has chronic heart failure tells the nurse, "I was fine when I went to bed, but I woke up in the middle of the night feeling like I was suffocating." The nurse will document this assessment finding as paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea is caused by the reabsorption of fluid from dependent body areas when the patient is sleeping and is characterized by waking up suddenly with a feeling of suffocation. Pulsus alternans is the alternation of strong and weak peripheral pulses during palpation. Orthopnea indicates that the patient is unable to lie flat because of dyspnea. Pleural effusions develop over a longer time period. Next, during a visit to a 78-year-old with chronic heart failure, the home care nurse finds that the patient has ankle edema, a 2-kilogram weight gain over the past 2 days, and complains of feeling too tired to get out of bed. Based on this data, the best nursing diagnosis for the patient is activity intolerance related to fatigue. The patient's statement supports the diagnosis of activity intolerance. There are no data to support the other diagnosis, although the nurse will need to assess for other patient problems. Next, the nurse working on the heart failure unit knows that teaching an older female patient with newly diagnosed heart failure is effective when the patient states that. Answer, she will call the clinic if her weight goes from 124 to 128 pounds in a week. Teaching for a patient with heart failure includes information about the need to weigh daily and to notify the healthcare provider about an increase of 3 pounds in 2 days or 3 to 5 pounds in a week. Nitroglycerin patches are used primarily to reduce preload, not to prevent chest pain, in patients with heart failure and should be used daily, not on an as-needed basis. Diuretics should be taken earlier in the day to avoid nocturia and sleep disturbance. The patient should call the clinic if increased orthopnea develops rather than just compensating by further elevating the head of the bed. Next, when teaching the patient with newly diagnosed heart failure about a 2,000 milligram sodium diet, the nurse explains that foods to be restricted include milk, yogurt, and other milk products. Milk and yogurt naturally contain a significant amount of sodium, and intake of these should be limited for patients on a diet that limits sodium to 2,000 milligrams daily. Other milk products, such as processed cheeses, have very high levels of sodium and are not appropriate for a 2,000 milligram sodium diet. The other foods listed have minimal levels of sodium and can be eaten without restriction. Next, the nurse plans discharge teaching for a patient with chronic heart failure who has prescriptions for digoxin and hydrochlorothiazide. Appropriate instructions for the patient include: notify the healthcare provider if nausea develops. Nausea is an indication of digoxin toxicity and should be reported so that the provider can assess the patient for toxicity and adjust the digoxin dose if necessary. The patient will need to include potassium-containing foods in the diet to avoid hypokalemia. Patients should be taught to check their pulse daily before taking the digoxin. If the pulse is less than 60, to call their provider before taking digoxin. Diuretics should be taken early in the day to avoid sleep disruption. Next, while admitting an 82-year-old with acute decompensated heart failure to the hospital, the nurse learns that the patient lives alone and sometimes confuses the water pill with the heart pill. When planning for the patient's discharge, the nurse will facilitate a referral to a home health care agency. The data above about the patient suggests that assistance in developing a system for taking medications correctly at home is needed. A home health nurse will assess the patient's home situation and help the patient develop a method for taking the two medications as directed. There is no evidence that the patient requires services such as a psychologist consult, long-term care, or around-the-clock home care. Next, following an acute myocardial infarction, a previously healthy 63-year-old develops clinical manifestations of heart failure. The nurse anticipates discharge. Teaching will include information about angiotensin converting enzyme inhibitors, or ACE. ACE inhibitor therapy is currently recommended to prevent the development of heart failure in patients who have had a myocardial infarction, and as a first-line therapy for patients with chronic heart failure. Digoxin therapy for heart failure is no longer considered a first-line measure, and digoxin is added to the treatment protocol when therapy with other medications such as ACE inhibitors, diuretics, and beta-adrenergic blockers is insufficient. Calcium channel blockers are not generally used in the treatment of heart failure. The beta-adrenergic blockers are not used as initial therapy for new-onset heart failure. Next, a 53-year-old patient with stage D heart failure and type 2 diabetes asks the nurse whether heart transplant is a possible therapy. Which response by the nurse is most appropriate? Answer is, the choice of a patient for a heart transplant depends on many different factors. Indications for a heart transplant include end-stage heart failure or stage D, but other factors such as coping skills, family support, and patient motivation to follow the rigorous post-transplant regimen are also considered. Diabetic patients who have well-controlled blood glucose levels may be candidates for heart transplant. Although heart transplants can be associated with many complications, this response does not address the patient's question. Next, which diagnostic tests will be most useful to the nurse in determining whether a patient admitted with acute shortness of breath has heart failure? Answer is B-type natriuretic natriuretic peptide. B-type natriuretic peptide, or BNP, is secreted when ventricular pressure increases, as they do with heart failure. Elevated BNP indicates a probable or very probable diagnosis of heart failure. A 12-lead electrocardiogram, arterial blood gases, and troponin may also be used in determining the causes or effects of heart failure, but are not as clearly diagnostic of heart failure as BNP. Next, which actions should the nurse include in the plan of care when caring for a patient admitted with acute decompensated heart failure who is receiving nesiritide? Answer is monitor blood pressure frequently. Nesiritide is a potent arterial and venous dilator, and the major adverse effect is hypotension. Because the patient is likely to have orthostatic hypotension, the patient should not be encouraged to ambulate. Nesiritide does not require titration and is used for ADHF, but not in a home setting. Next, a patient with heart failure has a new order for captopril, 12.5 milligrams by mouth. After administering the first dose and teaching the patient about the drug, which assessment by the patient indicates that teaching has been effective? Answer is, I will call for help when I need to get up to use the bathroom. Captopril can cause hypotension, especially after the initial dose. So it is important that the patient not get out of bed without assistance until the nurse has had a chance to evaluate the effect of the first dose. The angiotensin converting enzyme, or ACE inhibitors, are potassium sparing, and the nurse should not teach the patient to purposely increase sources of dietary potassium. Increased shortness of breath is expected with the initiation of beta adrenergic blocker therapy for heart failure, not for ACE inhibitor therapy. ACE inhibitors are best absorbed when taken an hour before eating. Next, a patient who has just been admitted with pulmonary edema is scheduled to receive the following medications. Which medication should the nurse question before giving? Answer is carvedilol. Although carvedilol is appropriate for the treatment of chronic heart failure, it is not used for patients with acute decompensated heart failure because of the risk of worsening the heart failure. The other medications are appropriate for the patient with ADHF. Next, a patient with a history of chronic heart failure is admitted to the emergency department with severe dyspnea and dry, hacking cough. Which action should the nurse do first? Answer is auscultate the breath sounds. This patient's severe dyspnea and cough indicate that acute decompensated heart failure is occurring. ADHF usually manifests as pulmonary edema, which should be detected and treated immediately to prevent ongoing hypoxemia and cardiac respiratory arrest. The other assessments will provide useful data about the patient's volume status and also should be accomplished rapidly, but detection of pulmonary complications is the priority. Next, a patient with chronic heart failure who is taking a diuretic and an angiotensin converting enzyme inhibitor and who is on a low sodium diet tells the home health nurse about a 5-pound weight gain in the last 3 days. The nurse's priority action will be to assess the patient for clinical manifestations of acute heart failure. The 5-pound weight gain over 3 days indicates that the patient's chronic heart failure may be worsening. It is important that the patient be assessed immediately for other clinical manifestations of decompensation, such as lung crackles, a dietary recall to detect hidden sodium in the diet, reinforcement of sodium restrictions, and assessment of medication compliance may be appropriate interventions, but are not the first nursing actions indicated. Next, a patient in the intensive care unit with acute decompensated heart failure complains of severe dyspnea and is anxious, tachypneic, and tachycardic. All of the following medications have been ordered for the patient. The nurse's priority action will be to answer is give IV morphine sulfate 4 milligrams. Morphine improves alveolar gas exchange. improves cardiac output by reducing ventricular preload and afterload, decreases anxiety, and assists in reducing the subjective feeling of dyspnea. Diazepam may decrease patient anxiety, but it will not improve the cardiac output or gas exchange. Increasing the dopamine may improve cardiac output, but it will also increase the heart rate and myocardial oxygen consumption. Nitroglycerin will improve cardiac output and may be appropriate for this patient, but it will not directly reduce anxiety and will not act as quickly as morphine decrease dyspnea. Next, after receiving change of shift report on a heart failure unit, which patient should the nurse assess first? The answer is a patient who is cool and clammy with new onset confusion and restlessness. The patient who has wet cold clinical manifestations of heart failure is perfusing inadequately and needs rapid assessment and changes in management. The other patients also should be assessed as quickly as possible but do not have indications of severe in-tissue perfusion. Next, which assessment finding in a patient admitted with acute decompensated heart failure requires the most immediate action by the nurse? Answer is oxygen saturation is 88%. A decrease in oxygen saturation to less than 92% indicates hypoxemia. The nurse should administer supplemental oxygen immediately to the patient. An increase in apical pulse rate, 1 kilogram weight, and decrease in urine output also indicate worsening heart failure and require nursing actions, but the low oxygen saturation rate requires the most immediate nursing action. Next, a patient has recently started on digoxin in addition to furosemide and captopril for the management of heart failure. Which assessment finding by the home health nurse is a priority to communicate to the healthcare provider? Answer is serum potassium level of 3 milliequivalent per liter after 1 week of therapy. Hypokalemia can predispose the patient to life-threatening dysrhythmias and potentiate the actions of digoxin and increase the risk for digoxin toxicity, which can also cause life-threatening dysrhythmias. The other data indicate that the patient's heart failure requires more effective therapies, but they do not require nursing action as rapidly as the low serum potassium level. Next, an outpatient who has chronic heart failure returns to the clinic after 2 weeks of therapy with metoprolol. Which assessment finding is most important for the nurse to report to the healthcare provider? The answer is blood pressure of 88/42 millimeters per millimeters of mercury. The patient BP indicates that the dose of metoprolol may need to be decreased because of hypotension. Bradycardia is a frequent adverse effect of beta-adrenergic blockade, but the rate of 56 is not unusual with adrenergic blocker therapy. Beta-adrenergic blockade initially will worsen symptoms of heart failure in many patients, and patients should be taught that some increase in symptoms such as fatigue and edema is expected during the initiation of therapy with this class of drugs. Next, a patient who is receiving dobutamine for the treatment of acute decompensated heart failure has the following nursing interventions included in the plan of care. Which action will be most appropriate for the registered nurse to delegate to an experienced, licensed, practical vocational nurse? Answer: monitor the patient's blood pressure and heart rate every hour. An experienced LPN, LVN would be able to monitor blood pressure and heart rate and would know to report significant changes to the RN, teaching pattern patients, making adjustments to the drip rate for vasoactive medications, and monitoring for serious complications such as extravasation, require RN level education and scope of practice. Next, after receiving change of shift report on a heart failure unit, which patient should the nurse assess first? Answer: patient who is taking digoxin and has a potassium level of 3.1 milliequivalents per liter. The patient's low potassium level increases the risk for digoxin toxicity and potentially fatal dysrhythmias. The nurse should assess the patient for other signs of digoxin toxicity and then notify the healthcare provider about the potassium level. The other patients also have the side effects of their medication, but their symptoms do not indicate potentially life-threatening complications. Next, based on the Joint Commission core measures for patients with heart failure, which topics should the nurse include in the discharge teaching plan for a patient who has been hospitalized with chronic heart failure? The answer is how to take and record daily weight, date and time of follow-up appointment, symptoms indicating worsening heart failure, actions and side effects of prescribed medication. The Joint Commission core measures state that patients should be taught about prescribed medications, follow-up appointments, weight monitoring, and actions to take for worsening symptoms. Patients with heart failure are encouraged to begin or continue aerobic exercise such as walking while self-monitoring to avoid excessive fatigue.